do quick mic checks just to make sure everyone's working. Nicole?
Good afternoon.
Kate?
Hi, everyone.
Ben? Hello, Ben. Joanna, well, let's go to you.
Hello.
Ben, are you working yet? Okay. So we are already streaming live on YouTube. I want to thank everyone for joining us today. I see we have a media partner joining us, I think from the Waterloo Chronicle as well. So we have a number of people here to answer your questions. Dr. Hsiu-Li Wang, Chair Karen Redmond, and our CAO Bruce Lochner are all here. We do have a limited amount of time today, so we're hoping that we can try to stick to 2 questions each, and we'll see where we get with that. And we'll get started with Nicole from CTV. Go ahead, Nicole.
Hi, Dr. Wang. For our viewers who weren't a part of the Board of Health meeting, you said some stuff at the beginning. Are you able just to quickly repeat some of the things that you said about how the spread has quickly escalated?
Sure. So we are in a serious situation. The spread of COVID-19 has escalated rapidly in Waterloo region. We are speeding fully into the red zone. If we do not make major changes now, we will continue towards the lockdown zone. So starting today, we need to dramatically reduce our social interactions. 1, we need to stay home and only go out for essential purposes like going to work, school, getting groceries, keeping a medical appointment, or doing essential exercise outdoors. 2, we need to limit our social interactions to only those within our own households, which can include 1 or 2 essential caregivers or essential supports for someone who lives alone. This means we need to avoid social interactions with friends, with coworkers outside of work, and with extended family outside of our households. Does that work?
Yeah, yes. I was just wondering, you signified that we are heading towards the red zone. Can you give us a firm date, how you're going to ask the province for them to approve it for this Friday, and then it would come into place next week?
Yeah. So I've been in discussions with the province, and Dr. Emily, who was covering for me last week, started those discussions last week, and we are keeping them informed about our situation, and they will be reviewing our situation this week. And they are well aware that our parameters are speeding into the red zone. At the time that they announced the categorization of health units for this past Friday, our indicators at the time were both in the red and the orange, but we are clearly now going into red. And so, the province has been very responsive to discussions with us. And so I anticipate that, we will be moved to the category which best represents where we are right now, which is red. And so that is why I would like the community to be aware and to be prepared for this on Friday. That said, I'm asking all the residents to, starting today, to take those personal actions that we can take to reduce the social interactions in our own personal lives, because that will have a significant impact on the rate of spread in our region. But we want everyone to understand that we can't do it without their help. We need everyone to pull together, and we need to slow down the spread in Waterloo region. And the best way to do that is to reduce our social interactions. starting today, dramatically reduce our social interaction starting today.
You had said
Sorry.
something during the briefing about Waterloo Region is one of the fastest surging places in Ontario. Is that something you're able to reiterate and give us, perhaps our placement in the province? Are we now more hotter than Toronto or Peel?
Yeah, no, thank you for the question, Nicole. So, just over 2 weeks ago, we were doing quite well compared to the province. And in the last 2 weeks, especially in the last week, we have really surged. And currently, our case rates are slightly ahead, I believe, of Halton and Hamilton's even, who were placed in red zone last Friday. So still behind places like Toronto, Peel, and York, but either approximately equal or slightly ahead of Hamilton and Halton. And this just only happened in the last day or two.
Would you be willing to take further steps like Dr. Lowe did in Peel?
Yeah, no. Yes, I'm always willing to take the steps. The question is, what is the best approach for Waterloo Region? Now, if a medical officer of health were to layer additional restrictions onto a region in orange so that they would mirror the restrictions in a red zone, the businesses that would be affected would not be able to would not be eligible for the financial compensation that is available to businesses in areas which have been placed in the red zone by the province. So that's an important consideration. Number two, the businesses were told they need to go into orange as of today. To go into red, you have to first go into orange. You have to first put in the restrictions that allow you to be in orange, and then you layer on the red. So businesses need to take the orange step anyways. And so, I don't believe that the few days between now and Friday is really going to have that much of an effect. Once people are aware of our situation and the fact that I believe we're moving to red, and the fact that they do need to actually put in place the orange restrictions first before they can layer on the red ones. And I definitely want all our businesses to be able to benefit from all the compensation that is available for red zones. And so that is why I'm working with the province to move us as quickly as we can be moved.
Thank you.
Okay, thanks, Nicole. We'll move on to Kate from CBC. Go ahead, Kate.
Thank you. Dr. Wang, during the Board of Health meeting, you said, because of the choices we've already made, which are being reflected in our rates today, a difficult period of restrictions. Can you elaborate a little bit more on the choices we've already made? Because I think people think, oh, well, sorry, my dog. I think people think that Thanksgiving was sort of the bad thing, and then cases didn't spike after Thanksgiving. But we're seeing it now.
Yeah, no, I totally understand where you're coming from. So, yeah, so, we do have some links to the GTA in terms of our, cases and contacts, but we also have our own behaviors. In the region, what I mean by choices we've made is our rates today reflect behaviors that occurred about 2 weeks ago. And, when we investigate the cases today, we find there's a lot of relaxation of the measures. And, I'm not quite sure what has happened, but I wonder if people have felt, we were doing really well and maybe the risk is lower here. But COVID will take advantage of any vulnerability, any time we let down our guard. And so, it's happened. This is what I was concerned about with COVID, is that once it starts to spread, it can accelerate quite quickly. And so, it's happened. It's already happened. And so in order for us to, as quickly as possible, reverse the trend, we need to dramatically change social interactions, because that is the factor that is going to help us the most, because that's the factor that's driven our case rates the most. People interacting with other people outside of their household, lots of contacts outside their household, or interacting with their coworkers, at the workplace or outside of the workplace, but in a manner that doesn't include social distancing, does not include masking. I'm sorry. We've seen that happen, and this is what is these types of gatherings and get-togethers where people are not masking and social distancing is leading to these clusters and these outbreaks. And then you have these cases that show up in all these settings because everything is open, because we are trying to keep everything opened. But when you have a lot of it, some of it's going to lead to more clusters and more outbreaks. And then that leads to more cases. And then it's a vicious cycle. So this can happen very quickly at COVID. And unfortunately, that's what we've seen in this region. So the best thing for us to do now is to act on the social gatherings and to limit, our interactions in general, by also only going out for essential purposes. That's the recommendation in all the red zones right now, that people only go out for essential purposes. And I would like our community to start acting on that today.
Now, during the Board of Health, your words were really heavy and stark. And do you think that this will serve as a wake-up call for people who, maybe they haven't been following public health guidelines as well as maybe they should have been?
I hope so. I know many people are doing their best. And, I've heard from some people that are frustrated because they're doing all they can. And then they, maybe not everyone is. And so my words are, I'm very concerned. This is serious. And it can be hard for people to grasp because, we don't see, the hospitalizations and the deaths that we saw in the first wave. But what I'm trying to make people aware of is that when you have this degree of case growth, when you have this degree of spread, even if a large number, the majority, recover, you're going to have a lot more people eventually in the coming weeks that are older, get sick, have to be hospitalized, go into ICU, and then die. And the best indicator for that, for us in Waterloo region, is what's already happened in other areas, like in the GTA, right? They were a little bit ahead of us, and now they're starting to see, and the province overall, when you take a look at the provincial numbers, they're starting to see those hospitalizations climb. They're trying to see those deaths climb, because that happens in the few weeks after you have a surge. Even if most of the cases are still in the younger people, it's because you have that many more people that are infected. So even if, only some of them transmit to older people, you're just going to have more older people that are infected. And then that's going to show up later in severe illness, hospitalizations, and deaths a little later. So as I mentioned, it's like the tip of the iceberg. And sometimes it's hard for people to imagine that it's really serious until they see some of those things. But the unfortunate thing is, when you see those things, like what we're seeing in some areas of Toronto right now, or Peel, probably more, in terms of their hospitals being overwhelmed, when you get to that point, it is much harder to bring down the rate of spread. and you're going to have a lot more hospitalizations, serious illness, and deaths before you can reverse the trend. This is why I'm going out today. We can see the trajectory. We can see where we're going because our case rates have increased. So now is the time to make those changes and very dramatic changes in terms of our social interactions to have the best chance of reducing the negative health impacts, but also reducing, the serious restrictions that will await us if we do not stop this spread, slow it down, and work towards going in the other direction, towards green.
Thank you very much.
Can I comment? Sorry, Kate.
Did you want to, sorry, Bruce, were you going to say something?
Yeah, if I could. Thinking back to my old hat at Ontario Health, in the spring, we had the same circumstance where it seemed like we were okay with health system capacity. And I won't speak for the health system. Ron and Lee and Patrick can do that. I'll only speak to the experience of it looks like we're okay. And then all of a sudden we get a major incident in long-term care homes or retirement homes. And I remember in another jurisdiction, 30 people evacuated from a retirement home quite quickly. So imagine our capability in a hospital when that happens in hours, and then all of a sudden what happens in terms of capability. So I just want to reemphasize what Dr. Wang is saying, that it may look okay. We don't want to put our residents in that situation where all of a sudden we turn to our health system and it's overwhelmed. And I know our hospital leaders are imploring people to please follow public health guidance. We quickly could find ourselves in the circumstance of many other jurisdictions and many other European countries and so on that found themselves fine one day and in deep trouble the next. So I'm quite concerned. I share Dr. Wang's concern that this is above anything we've seen before and anything we saw in the spring.
And Kate, if I can just jump in, because really part of your question was about messaging, and the messaging has absolutely changed. And Dr. Wang and Bruce are sort of giving you the rationale why, but it's also why we've asked all the bylaw enforcement and the public health inspectors to move away from education and move to enforcement. And I mentioned, and I think Dr. Emily mentioned this last week, but we also have 30 interministerial health officers in Waterloo region to help with enforcement. And we take this very seriously, and workplace spread seems to be one of the places where the pandemic is spreading. So I wrote to both ministers at the provincial and federal level asking for help in contact tracing. So this is a different message that we're sending to the public. And it's based on the evidence that Dr. Wang has talked about.
Kate, you're good, Kate? You don't have any follow-up? Okay. Joanna, we'll move on to Joanna from the record. Go ahead.
Thank you. So today we're talking about the very likely prospect of moving into red on Friday. Are you concerned that then the week after that, we're going to go into lockdown?
I hope not. Right now, it's not really clear because there are no criteria associated with it. What lockdown, when a region would meet the threshold for lockdown and what the restrictions would be, right? So that is something that I know the government is working on. That was another point, sorry, I meant to mention it when Nicole asked me the question about, am I ready to act if the province, and why I said I'm working with the province is because they're also looking at the restrictions. They lowered the threshold last week, but they're also looking at the restrictions. And so we may have some, updated information when they go out again Friday about what would be required for a lockdown zone, for example. So I just know that, when you take a look at a couple of the areas in our province which have been in red for quite a while. They have been in modified stage 2 even before then, and they are still struggling with their case rates, which is still rising. I think you can anticipate that there's a point at which some regions will be put under lockdown. And so, you know, if we continue down this path and we do not make major changes to reduce our social interactions in Waterloo Region, we will continue speeding ahead past red into a zone that could be locked down. And so, well, we'll end up in being locked down if we can't stop the acceleration. We just don't know exactly when, but you know, the thing that we need to do now is we need to be prepared for red, and we need to help our businesses, help our communities by the personal actions that we take to reduce our social interaction with others. That's what we need to focus on right now. Oh, I'm sorry, Joanne, I can't hear you.
Joanna.
Sorry. Just regarding hospitalizations,
Yes.
there's been a lot of talk about how they're not as bad this time around. But do you think that that kind of gives people a false sense of security, that it's not that serious? Because having talked to anyone like a healthy young adult who has been like dramatically affected by this illness, but not hospitalized, I think sometimes that's sort of forgotten in this. Like, you still don't want to get it because you could become very ill and like really have your life affected.
That's a great point, Joanna. So you're absolutely right. You know, hospitalization is very serious, but a lot of people have serious illness that really affects them, and they could have lasting effects too. I mean, we're not, you know, we don't have clarity right now on just how long some of these effects can last, but we do know there are some people that recover from COVID, right? But then they have these lasting health effects. And so there's more evidence accumulating on that, you know, as we go. But people can not only get seriously ill, but they can have lasting effects even when they're young. So that's a concern. The other concern, which is, you know, the hospitalizations, once they start, they can climb quite quickly, and the deaths as well. And that's what we're seeing in other places in Ontario. You know, that higher rates so far. Now we're starting to see the hospitalizations and deaths climb. And, you know, I'm in regular contact with the hospital CEOs, and, you know, we have 11 on our dashboard, but we have a number of new admissions that are occurring today. And so our dashboard is going to be updated again tomorrow, and they're going to show that our hospitalization you know, has essentially tripled over the last, I would say, 72 hours or so. So that just gives you an example of this can happen quite quickly. And this is like Bruce said, this is all of a sudden everything seems fine, and then it can accelerate very quickly. So that's, you know, so that's the concern, and it's. I totally understand people not seeing it as serious right now in the second wave, but that's an illusion because our rates of spread in the general population are high right now. And that will lead to a lot of people in the older age groups eventually becoming ill. And then that will lead to a lot of consequences. If we make changes now, we can help prevent some of that.
Okay, thank you.
Thanks, Joanna. We'll move on to Lauren from Waterloo Chronicle. Go ahead, Lauren.
Hi, Lauren.
Hi. So I just kind of quickly just wanted to confirm, I know that you mentioned that you've been working with the province. Similarly to last week, has the region specifically asked to be moved up into the red category? Or is that in talks? I'm just wondering if that's been confirmed.
You know, I'm last week, Dr. Emily advocated, and this week I continue to advocate that we be placed in the category that we belong in. And our indicators are speeding right into red. And so I anticipate that, we will be placed in the red. Yeah, so I continue to support a move to red because that's where we are right now.
And then just quickly as well, I often focus quite a bit on New Hamburg, and previously there hadn't been very many cases at all. And recently now it looks like there's 16 cases up from, very few. I'm wondering if you could just provide a little bit more insight on New Hamburg specifically, if you have access to that data.
Yeah, I don't, have the information about the specific cases, but I'm not surprised because this is just reflective of significantly increased spread in our community. And so even in areas that have had lower numbers of cases, they're going to start to increase now. And, that's just what we expect when the spread across the region has significantly increased. So even though it will continue to be the more populated areas that will have more cases, even in the townships, I think we'll see more cases going forward.
Thank you, Dr. Wang.
Okay, and thank you, Lauren. We'll now move over to Ben from 570. Go ahead, Ben.
Hey, how are you doing this afternoon?
Hi, thank you.
Dr. Wang, if you look at Nunavut today, they are completely closing non-essential businesses and schools for 2 weeks. They have around 18 cases. If we are on a speeding train, like you've said, why would we not use all the brakes we have? Why would we not impose more heavy restrictions to try to stop the spread?
Yeah, no, thanks for your question, Ben. So, we are under a provincial framework. And as I mentioned, we are working with the province to move us to the appropriate zone for Waterloo region, which I believe is red. Those types of restrictions, when they come, they will affect the businesses. That's going to significantly reduce interactions in those settings. But what I'm doing today is to ask residents to start changing their own social interactions and doing what they can as individuals starting today to significantly slow the spread. And that's in their own personal lives with respect to social gatherings and with respect to only, leaving their home for essential purposes, even if there are settings that are still allowed to be opened under, the different categories right now. The openings for certain of these settings will be further restricted under a red zone, but that's legally what's allowed to be opened. But what I'm asking is that residents take action in their personal lives, which can have a major impact on social interactions and have a major impact on spread. I'm asking for residents to do that today, regardless of what the restrictions may be on specific businesses. What will happen in the red zone, will be more restrictive than what's in the orange zone. So there will be, as a function of moving to the red zone, a decrease in social interaction in various business settings as a result.
Right. Well, let me ask you a bit of a hypothetical question then. If you were to use your powers to move the region into red restrictions, let's say tomorrow, and then businesses would not be eligible for some financial supports like you said, but then if the province agreed and then classified us as the red zone on Friday, would they then become eligible a few days later?
I don't know I guess that's maybe hypothetical. I wouldn't be able to answer, but the thing is, Ben, they need to implement the orange restrictions anyway to be able to implement the red. So it's the red restrictions. Each time you go up a level, it's a layering on. So they've been told they've been given warning. They're going to enter orange today. So they need to have the orange restrictions implemented. And then if we go to red, they would have red restrictions layered on top. But, I'm not sure how much time would be saved from going straight to red, because they would still need to implement the orange restrictions and then go to the and then layer on the red. I think it's businesses have already also prepared for orange. We have to balance their ability also to adapt. And I think, this is already quite quick in terms of a change, because 2 weeks ago we were green, then we became yellow, now we're orange, and we could be moving into red. So at each stage, they have to up their precautions. And so I think we need to give them a little bit of time as well. And it would have no practical impact, in terms just a few days. In addition, as I mentioned, the province is looking at potentially changing the restrictions under the red. So I think that would be potentially very confusing if I went ahead, put in red, potentially depriving our businesses of economic supports, and then on Friday the province puts out changes to the red, and then what are they supposed to follow? So that's another reason that I don't want them. I don't want to put on something individual right now, because I think in the overall scheme of things, it would be more disruptive and less helpful than if we continue to be under the provincial framework and be able to, as a guarantee, be able to access financial supports.
Thank you.
My dog is now going to bark. Sorry, everyone. So we've gone through the group once. We maybe have a little bit more time. Okay, Nicole, but you technically already asked 2 extra questions. I'm keeping score. Okay, so we'll do one more round, but let's try to go quickly because these folks have to get on to other meetings too. Okay, so Nicole, go ahead.
Okay, really quick. I am just wondering, in terms of enforcement, are you able to provide us with how many officers, you said, Chair Redmond earlier during the Board of Health meeting, are going out and asking them to be, I guess, a bit more aggressive? And were there any actual fines this weekend as a result of Diwali?
So Julie's going to answer if there are any more fines, but what my message is that we have pivoted from education to enforcement. So that includes area bylaw officers, regional bylaw officers, as well as public health inspectors. As a Board of Health, we reached out to the province, and for the next few weeks, we have a provincial multi-ministry team of almost 30 provincial offenses officers across the region to carry out enforcement of high-risk businesses that we're seeing spread because people are letting their guards down. So those 30 officers are interministerial, and they will augment the activities that our current local inspectors are already doing.
So in terms of enforcement numbers, we'll have an update later this week at the next media briefing. It usually takes us a few days to get the results, anything from the weekend. And I don't know, I haven't heard of any enforcement actions, but they may still be gathering that from our enforcement partners.
Okay, thank you.
Okay, so who else had questions? Go ahead, Joanna.
Just wondering if you could provide a few more details about the death that was reported today.
Oh, yes, I'm just going to, sorry, I just need to pull that up from my, 1 second here.
I have information
Oh,
as well.
Yes, go ahead, Julie, thank you.
So the individual was a female in her 90s with other underlying health conditions.
Okay, thank you.
Julie, was she in the hospital?
I do not have that information, Kate. Wasn't provided to me.
Thanks.
Any other questions, Joanna? That was it?
Yes, I can tell you she was.
She was in the hospital.
She was, yes.
Okay, thank you. We can move on to Ben from 570.
Hi, thanks. Dr. Wang, I was just wondering if we know, as far as business settings in school and other settings in the region, is there any particular area that we're seeing the most cases from, or does it continue to be social settings?
Yeah, no, thank you for that question. So it's a great question. So in business settings, we're seeing a lot of outbreaks in business settings. In areas where, predominantly in areas where it's an employee-only setting. So we have a number of outbreaks in businesses and workplaces, and we see, unfortunately, too many instances of workers, letting their guard down with their coworkers, and then infection being passed between coworkers, or the businesses not really enabling or enforcing distancing and masking in employee-only areas. We also do see from time to time, although we haven't seen it as much here as in other areas, we can see some patron-to-patron transmission. And, if we take a look at Ontario as a whole, we are seeing more and more evidence of transmission between patrons in environments where people, because of the nature of the environment, they're not able to physically distance or mask all the time. So, in indoor dining settings or in indoor fitness settings, there is a greater risk because people cannot mask when they're eating and when at their table, even though tables are separated 6 feet at least from each other, the people at the table are not separated 6 feet, right? And we've seen this more in other jurisdictions, but we have had a case here ourselves where transmission has occurred in a restaurant setting indoors. And so we do know that, the restaurant owners are doing their very best, and they are trying to put in all the right precautions. But it is a situation where there is a greater risk of spread due to the nature of the interactions in those settings. Fitness settings, when you do a strenuous exercise, physical activity, you need to have a greater distance, which is why recently the requirements for indoor fitness settings have people now distanced more than 6 feet. And now they have to be distanced 10 feet because the strenuous exercise leads to greater spread in those environments. So those are environments, and the businesses have been working really hard to keep up and to adapt. But we are seeing evidence of spread in those settings where there is a bit of a greater risk, and so that's also part of what I'm trying to advise people of. If you stick to your if you stick to your immediate household in terms of social contacts, when you go to a restaurant, when you go out somewhere, that is going to limit spread than if you have a social gathering, whether it's a gathering that's private or it's a gathering in an establishment. If you have a social gathering, you have multiple other people, right? Even if the limits are higher legally, given our state of spread of COVID. Right now, what we need to do is reduce our social interactions. So that's why I'm asking people to stay within their household circles. I shouldn't say the word circles, maybe. Stay within their households, immediate households, and only go out for essential purposes.
Right. And those businesses you mentioned where it's just employees only. Karen Redmond, did you say that that's where the provincial officers are going to be focusing their efforts?
I think that answer was in response to where we think there is spreading in the community, Ben. The reality is the officers will go to a variety of places. They will go to workplaces. They will go to some of the places where our bylaw officers and public health inspectors have been, and they may go into other workplaces as well. Some of the people represented are from the Ministry of Labor, and they have sort of a more of a workplace focus. So it'll be a variety of places that they go, not just any one exclusive place.
Okay, thank you.
Thank you, Ben. So we have gone through all the hands. Anybody else? Okay, I want to thank all of you very much for showing up today. We know this was put in your schedule at the last minute, and we appreciate you getting the word out for us. We'll see you again later this week on Friday. Take care.